Welcome to the Getting Real with Hilary show, where ordinary heroes tell extraordinary stories during unique and never been heard before conversations with your host, Hilary Arno Burns. Hilary's unique listening and way of asking questions results in conversations that aren't usually talked about, so you can create the life that you really want but are afraid you can't really have. We are demonstrating the greatness and the human spirit in creating a world where we all reclaim our birthright of joy, happiness, purpose, and passion. Now, here's your host, Hilary Arno Burns. Welcome to the Getting Real with Hilary show, and today we have a very special guest. We have Dr. Tali Arviv. She was an internal medicine physician, but now practices mostly cosmetic procedures. So we're going to talk about all sorts of questions that I've always wanted to ask and hopefully answer some of yours as well. Welcome to the studio, Dr. Arviv.
Thank you. Hi.
Okay, I'm going to put my glasses on now so I can see. Yay. All right. So, well, can I tell them, do you mind what I said when we first met? I said, I think it was on the email. I said, I don't do any work. I have a lot of wrinkles. I don't know if you want to be on my show because obviously your skin is going to be perfect. And I don't know if I want to be next to you, but here we are. And you were like, oh, I think it'll be great. So here we are. Anyway.
You're a perfect patient, actually. A first-timer, a virgin.
A virgin, that's right. Haven't been called that in a while, but so thank you. Anyway, all right. So, well, let's just go back to when it all started. Where did you grow up?
Oh, I was actually born in Israel.
Israel, okay.
Mm-hmm. My husband told me not to say that. He's like, it's too much going on right now. I'm like, no.
No, come on. Come on, hubby. We're real here. We're just real. Okay. All right. And when?
In Israel, I pretty much graduated from high school there. I did a little bit of back and forth. So,
yeah. Did you go in the army?
I did not.
Oh, how'd you get out of that?
I married my boyfriend at the time, and that's pretty much the only way you, or one of the ways that you can get out as a female.
Really?
Married. They don't recruit females to the army that are married. Because now your job is to have babies and to raise your family and to take care of the kids.
Wow. So now, is that your husband now?
No.
Was he an Israeli?
He was.
He was. Okay. So he went in, right?
Yeah.
He had to go in, but you didn't. Wow. Okay. And how long did that last, that marriage? Long time?
Like 3 years. We just got married to kind of get through this military thing, and then we moved together to the US. And then eventually we just kind of grew apart. I went to college and he was kind of working and doing other things, and we grew apart, good terms, no issues. He ended up going back to Israel, living there. No kids, no, nothing crazy. And
where'd you go to college?
I went to Hillsborough Community College, and then I went into University of South Florida for my bachelor's. And then I went on to medical school at Ross University, which is actually, at the time, it was in Dominica in the West Indies. So you do like 16 months on the island, and then you come to the US to do all your clinical rotations. So they have hospitals in New York is where mostly I did my rotations. Mm-hmm. All over the country that they have contracts with to take on their medical students to get them their hours that they need for their clinical rotation. So I graduated from Ross, did all my clinical rotations in New York at different hospitals, and then I moved back to Florida because that's where family is.
Okay.
I did my residency in internal medicine at Orlando Regional Medical Center. And then when I got out, my mom's like, I started applying for jobs as a hospitalist, and my mom's like, no, you don't want to do that. Just come do aesthetics.
Your mom? Is she a doctor too?
Nope, she's not. She's a now I'd call her more of like an entrepreneur, but she's always been in the cosmetology world. She was a full cosmetologist, did hair and nails. I mean, sorry, not hair, nails, manicures, pedicures, waxing, permanent makeup. And then when laser hair removal became like this whole thing back in 2005, 2006, she's like, I'm tired of doing pedicures. I want to learn how to do laser hair removal. So she went to Orlando, which at the time was the only electrolysis school in Florida. And while she was, doing people's nails, she was driving there to get her hours in, got her laser license, bought a laser machine, opened a laser clinic. And then she said, I'm tired of doing services. I'm going to open a school for electrolysis and laser hair removal. So she opened the second school in Florida for electrolysis and laser hair removal. Then she added a facial program and all that. And that school still exists. That's the Beauty and Health Institute, which is they just recently moved to a larger facility. So they're off of Kelly Road here in Tampa, Florida. And they're still offering electrolysis, laser, and facial programs. And so she kind of left that to my brother. And then just when I graduated from residency, she opened the med spa. She rented out a small space and said, let's just do the med spa here. And she had a few girls that she graduated. My mom's always helped women. Like she's always been like, let me help you open your business. Let me help you, just be your own boss. And here's your new career. And here's how you can make money. And she wouldn't charge anybody anything. Like if you're coming to her already, students, and she's Russian, so she's got a lot of people from the Russian community. But everybody would like know Rita. Where's Rita? I gotta ask her something. But long story short, she opened she rented out the space, the med spa space. And so when I graduated from residency, she had the laser machine, which she rented out to a few students. And I was their medical director because at that point I had my license. So they started bringing clients in to do laser hair removal. And I was like, okay, I need to start learning how to do some of these other procedures. And then I went and got training in Botox fillers and everything else. Then she pushed me into doing like liposuction training. And then after a few years, we kind of like expanded a bit and then we opened multiple locations. So I opened the clinic with her in 2014 and then 2017, we opened Miami. And then end of 2021, we opened Ocala, and then I decided to open a surgery center because I was like, we could just do liposuction here. But
all right, can we go back? I have two questions.
Yeah.
If your mother was Russian,
Mm-hmm.
she went to Israel from Russia.
Yes.
And where did she meet your dad?
She was born in Ukraine, and then she immigrated to Israel. Met my father there. They were in the army at the same time, and then when I was about 4 or 5, she immigrated with him to the U.S. to Philadelphia because some of her friends immigrated already, and they were like, "Oh, just come here to Philly."
And she left you there?
No, she took me with her. We all went. It was me and my sister at the time.
Okay. But you went back to Israel
I went back to Israel when I was 10, and I actually lived with my grandmother, my mother's mother, until I was 15. And so
wow.
Then my mother moved back to Israel when I was 15, and she stayed there till I was 18, which is when we all came back together to the US. She decided to move back because my grandfather had metastatic gastric cancer, second time with cancer. First he had lung cancer, was resected, and then so she decided she's going to come back, spend some time with her dad, and then she ended up staying.
Okay. So then you all came back. Okay. And you have a sister? You have a sister?
Yes.
Okay. All right. So that was my first question. Second question. It seems like a lot of time you invested in medical school to become an internist, I guess, and not just drop it and go work with your mom. Like, what was that decision like? Did you not want to go there? Like, what was?
No, it was a little scary. I'm like, are you sure about this? Like, nobody teaches you about cosmetic anything in medical school. Like, you're not touching that in residency. You don't get to go do a rotation at an aesthetics clinic or a med spa, right? And most you're doing a dermatology rotation, which I did at Mount Sinai, but there's nothing aesthetics there. And I mean, she was kind of already in the industry with the school, and she had a doctor that was doing lipo and things like that. So on the one hand, I kind of like trusted her because she's my mom, but also because I'm seeing her doing these things already for a while.
Yeah.
But I didn't like I jumped into it, but I started initially like going once or twice a month to the hospital just to do moonlighting, which is when you just kind of provide some coverage. Just to kind of just in case and keep up with my skills. And
Yeah. And
so,
when did you realize, I don't want to do this, and you drop that?
oh,
Like
yeah,
when?
realized, I mean, I'm making $1,200 a day at the hospital, seeing over 20 something patients. And I'm like making that in an hour at the clinic. So why would I?
Oh, God.
And it's not that I do, I do love medicine. I think there's definitely, conventional medicine. Like, yes, we save people's lives. There's so many treatments but there's a lot of things that are lacking. And there's a lot of bureaucracy and a lot of things and paperwork and the insurance and the pharmaceuticals, not to get into all that because that's really where we're going. But I think everybody knows what I'm talking about.
Yeah.
Good and bad. But I just realized like the hospital is not where I want to be. And my job is pretty rewarding. Like I get to see women, they talk to me about things. So sometimes I'm kind of a little bit of a therapist.
Oh.
Talk to me about things. They feel comfortable sharing things with me. And they feel good when they leave the office. They're happy, they're more confident, and that makes me feel good too cuz it's rewarding to make people beautiful and take care of them however you can. And also, you're not in that you work for someone conventional box of like, I'm in the hospital, I can't say this, I can't talk about that, I can talk about this. Like maybe if nobody in the hospital is telling you, oh, well, if you have some kind of cancer, or maybe do a high dose vitamin C or some of these other non-conventional treatments, right? But I can talk to my patients about whatever I want. Right. So I like to have that option and I can and I do, when they tell me what's going on with them, I do talk to them about other things that might not be beauty and cosmetic related or something about their family member. If I could share something with them, my knowledge, you know, that could potentially help them or somebody else, then it's, yeah,
And you're not going to be fired for it because you're the boss.
right.
Yeah. That's great. Right? So,
Yeah.
okay. So you went there back to your mom had you just come and do us the aesthetics.
Yeah.
And what did you start doing then? What was the first thing you started doing?
Well, say that again.
Like when you first you went back to Florida after your rotations.
Mhm.
And what did you start doing first in terms
Oh.
of aesthetics? Yeah.
First I went and got training in injectables because that's kind of the bread and butter of every medical spa. Everybody really first people come in for Botox and fillers.
Okay.
And then my mom said, listen, we have to buy a laser. We have to buy a CO2 machine. And I'm like, okay, how much is the CO2 machine? So somehow she got me to finance two devices for 131,000. Of course, of course I remember that number because I'm like, are you sure about this?
For both? Not
Yeah.
each. Both. Okay.
We had a good deal. We had a person that she's had a relationship with for a long time and a vendor from Dave from Candela. He's the best. But so he gave us a good deal. We bought the devices, we financed it. And so I'm like, okay, we got to make this, whatever, $3,000 payment, whatever it was every month. Because usually they're financing it for like a 5-year term and then but it was fine. And then I realized when you look at the numbers later on, you're like, oh, okay, you could pay off a machine in like 1 year. In most cases, you can pay off your devices in a year.
And it was fun for you to do that stuff?
It was fun. I think the more you learn, the more fun it is. And I think that what happened to me, I've kind of transformed to this more business person than just a doctor. Like I have to put on that role of also managing and growing things and dealing with all the cycles that you go through, the seasonality, the ups and downs. We're not making as much, we are making more, but you still have the same bills or more. So, that, it's the stress. But it's definitely something that you learn a lot of things, just not knowing anything about business and then having to run a business. Even things like how to manage, talk to your employees about something that you want, or, how to take care of them, how to communicate better, how to be a good leader, because those things are hard. I mean, I remember in like my first years, I would, I would have like my own little meltdown in my office, something, but I'm like, "Oh, this is so stressful. And now I'm just very like cool and calm and like, okay, that's just the way it is. This is what happens. You just have to kind of get through it. And
So tell me something stressful that you might have had a meltdown about.
um mostly things, relating to like relationships. I take that really hard. If, I try, you try to help people, then sometimes it's not reciprocated. And you get kind of like screwed certain things.
Mm.
But I'm
So like,
I'm people who forgive. I don't hold grudges, and then I move on.
that's
But in the
great.
moment, you're really stressed.
So like if you did something, a procedure or something, and they didn't like it, or
Not
what?
like a patient thing, but like sometimes with an employee thing. But sometimes too, yeah, I guess that's happened to me too before. People are like, I had a lady who, you know, she did a whole year, like a membership, did multiple treatments. Somebody did a treatment on her and they weren't happy. So I was like, let me comp you what you paid and I will retreat you, and she was fine. She never came back, but then she disputed everything she did for a whole year. And I'm like, right, people are just whatever. Shit
Yeah.
happens.
You know what I learned? I'm just gonna say it because it's something I don't know if it's true, but I feel like when I bend over backwards for someone, trying to make them happy,
Hmm.
those are the ones that are gonna give it back to me. Do you know what I mean? They're not gonna be happy. B, they're gonna screw me over. They're the ones that always complain about how I lied or whatever. It's like,
It's
wow.
true.
No,
It's true. It does happen a
weird.
lot.
Yeah. And I realize, you know what? I can't keep other people happy. It's not my job,
Right.
right? So I
It's hard.
realize that they're
I
always
think,
gonna find something if they're that kind of person. They're
yeah, I
always gonna
think it's a
find something.
maternal female nurturing thing that we do.
Mhm.
Try to help. I think
Yeah.
COVID was really stressful too, like that time frame of, you know, seeing people and trying to keep the business alive while trying to keep people safe. What is my staff going to think if I do this or don't do that, or check a temperature or don't check a temperature, or wipe every doorknob or wipe every pen, or those are all things that you're like, oh crap. Um,
But
what do
you
you,
could stay open. You could stay open because you're in Florida. Because
we
we wouldn't
closed
have been
for,
able to.
yeah, we closed for a little period of time. I think it was like close to a month that we had to close, like 3 or 4 weeks.
Oh, some
Yeah.
places they were closed for years. Wow. So that's good. So then you got to keep your business open.
Yeah, I got to keep my business open, but when we had to close, we kind of did just a very, very low key, specific patients for specific procedures that we would see, just me and one other person. It wasn't like a whole staff kind of
Yeah.
open.
Wow.
Yeah,
Ooh,
but
okay.
you're still paying people. You're still, fortunately,
Good.
they had a lot of support. Like, right, they gave us um,
A
grants.
PPE.
right?
Yeah.
All those. So that was helpful because you can support your employees when they're not working.
Yeah. So, all right. So tell me, we were going to talk about, I forget. Let me look. You had said vanity and aesthetics.
Yeah.
What? So what does that mean? Vanity and aesthetics.
I guess I was just thinking about just the idea of like vanity in general and how far do people take it, right? How much social influence we have on what's trending or not trending. It's not vanity shouldn't really be, it shouldn't be like really a trend, but people like follow, everyone wants like a bigger butt and it's like, where did this come from? Why?
Yeah.
Um, so I mean, I
Do you
think
do stuff like that? You do
yeah,
bigger butts?
we do. But it's
Wow.
just more about kind of I guess I feel like for sometimes I understand, okay, people who want to do certain things and sometimes like you really don't need to follow a trend. You just, there's a lot of beautiful young women. It's like there's nothing wrong with you. You're perfect. Just be happy and love yourself, but there's definitely a lot of external influences and could probably be better at in society as far as what kind of influences we're putting out there. But at the end of the day, a lot of it is driven by monetary gain
For who? For you.
for not for just whoever's promoting these things, right? If it's like Kim Kardashian,
Oh,
whatever Kim Kardashian does, we want to do it. So yeah, it drives people to practices like mine to do certain things, of course, because they're seeing it somewhere else. But we
and
do
how
other.
does she how if someone comes to you for a bigger butt, how does Kim Kardashian make money or she doesn't?
No, not that she's just like I'm saying her as like a figure in general. Like things
Yeah.
are driven by, she could pretty much sell anything, right? If tomorrow she says this is what you need to do, then everybody thinks, well, if I look like this or then I'm going to be like her or
Wow. So, all right. So let's say a young girl comes in, wants a bigger butt.
Mhm,
And if you say, "Well, you don't really need that," or whatever, and she says, "But I want it."
mhm.
Obviously, she has to have money. You're gonna do it? You're gonna just do it?
I will, if it's not like a risk in terms of like her medical issues or anything like that, then I will consult her on, the risks to the benefits and what, you know, her expectations. It's really more about expectations than anything else. I feel like when it comes to aesthetics, because some people think they're going to get a lot more than what they're actually going to get. And
Okay.
you're gonna get like a facelift from a couple threads or a little bit of Botox and filler. Facelift is facelift and non-surgical is non-surgical. But so it's mostly about consulting them about having realistic expectations and understanding what they're getting out of the procedure.
So, okay, so I have a lot of questions, but if someone does get that, I'm assuming, what is that? Injectables? Is
There's
that
a couple
injectable?
options. You can like you can do fat grafting. So from your own fat. So you would liposuction, let's say the abdomen, and then you would transfer that fat. You liposuction into a sterile container. And then from that sterile container, you transfer that fat back into the patient's body wherever they want the fat. There's women who have done it for their labia. There's women who do it for their butts. Women want to do it for their face. They don't want to do fillers. They rather use their own fat to volumize their face and not put fillers in there. So, we do it for kind of different things. There's women who do it for their breasts. They don't want breast implants. They rather use their own fat to fill fat in their breasts, which is understandable.
And how long will that last? Forever?
As long as your fat lasts, it will last. The only thing that it doesn't always last, I would say initially. So after you put fat in, it doesn't always survive. Not all of it survives, right? So you might only have 50% of what you put in that actually those fat cells survive and engraft. And if you start to lose weight, you're going to have less fat again, right? So it will fluctuate with weight gain and weight loss.
What else? What other kind of things do you do? Like injectables, what is that?
So most injectables that are used are hyaluronic acid injectables. So they're something that's already found in your body that normally holds onto water. So it creates volume by holding onto water. But they go through a process called cross-linking, and it basically creates bonds with the hyaluronic acid. So your body can't just break it down as easily. So when you put it in, it's going to last you like a couple years, sometimes 1 year, 6 months, depending which product and how much you put in. So those are most fillers. You can add them to the cheeks, the lips. You can do like your smile lines, soften these. You can fill in hollow temples. You can sharpen up the jawline. You can build out the chin. We've put it in hands to kind of improve the appearance of hands, add some fullness. Earlobes, you can put them in earlobes. Just nose, like a non-surgical nose. Probably one of my favorite places is around the eyes because it just makes you look more youthful and less tired. And not everybody is a candidate for that, but if you are, then it's a great procedure. And of course, you can always do fat grafting there, but filler is an option without fat grafting.
All right, we're going to take our commercial break and we'll be right back.
What if school could be a place where every child feels safe to be themselves? Right now, kids are growing up in a complicated world. They're learning how to listen, how to care, and how to find their voice. Kokori's daily digital calendar of research-backed lessons helps children build confidence, empathy, and resilience through joyful play-based learning. When children feel connected and supported, they don't just learn more, they grow into kinder, braver humans. Kokori, helping kids grow together.
Hey, it's Hilary from the Getting Real with Hilary show. Life can be messy, raw, and real. And sometimes we're afraid to feel vulnerable. We're afraid to be that real self. Well, that's exactly what the Getting Real with Hilary show and Getting Real movement is all about. Being our true selves. Every week, I bring you stories of transformation, authenticity, and hope. People getting real with their struggles, their faith, and their breakthroughs. So don't miss a thing. Subscribe to my weekly newsletter today. You'll get stories, links to everything new, and how to create a life you love every week directly to your inbox. You can also find my books on Amazon. My courageous and riveting memoir, The Second Piece of French Toast, in case you feel stuck in your life and want to get inspired. How I came out about my no sex life and my marriage, and my second book, Real Talk. That one will get you speaking up in ways you've been too afraid to do so, and really creating amazing freedom. And my third book, How to Stop Fixing Yourself and Start Having Fun, the name is called Your Bullshit is Your Blessing. Find links to everything and subscribe to my YouTube channel, Getting Real with Hilary, and you'll find the links in the header. So, visit. And you can also visit gettingrealwithhilary.com because the real you is worth it and wants to come out. Hey friends, it's Hilary, and I want to share something that genuinely shifted how I see modern and contemporary art, and honestly, how I see the world. If you've ever felt like modern or contemporary art just wasn't for you, like you were supposed to understand it before you could enjoy it, you're not alone. And that's exactly what Robin Jameson turns upside down. Through innovative tours, talks, trainings, and educational programs, Robin doesn't explain art or tell you what to think. She guides you into actually experiencing it, personally, directly, and in a way that is powerful, moving, and even life-altering. She's also the author of The Magic of Modern Art, How to Love Modern and Contemporary Art. And what she shows people is this: you already have an innate affinity for all types of art. Through Robin's work, you are awakened to more than just a new, confident, and joyful relationship with art. You begin to see everything with fresh eyes, feeling more curious, open, and alive in the world. If you're looking to create a powerful, memorable experience for yourself, museum, organization, or community, visit magicofmodernart.com or email Robin, Robyn, at magicofmodernart.com and discover what's possible when art and life truly come alive. And thank you, as always, to our sponsors. And Dr. Arviv is a brand new sponsor, so we're excited about that. All right, I'm having some technical issues, but we're gonna just plow through. Okay. So, all right. So basically, there's a lot of options, and you work with people to help them. Obviously, there's budgetary constraints. My fear was always if I started, I would never stop, because how can you do one place and then not do the rest? Do you know what I mean?
A lot of
Is
people,
that a thing?
a lot of people don't do the rest. And I think it's a
Yeah.
personal thing. Like me, I if I can do something without surgery, I'll do it without surgery. And I just
Like what? So that's the
like if I can lose
injectables?
weight without surgery, then I won't do liposuction. If I can, just as far as like if I can tighten my skin without doing a facelift, then I would do that.
And how
Anything
do
that
you do that?
we do
How do you-
different energy modalities. There's like laser devices, radio frequency devices. So generally speaking, you're applying some sort of heat or coagulating, the skin underneath the skin, and that helps with skin contraction. Not to get into medical technical stuff, but temperature can help with inflammation. Most things in aesthetics are associated with inflammation. So when you create inflammation, you're triggering a healing process. And that healing process helps lay down new collagen fibers, get rid of the damaged stuff, and put down new stuff. So, as you're aging, you're losing collagen fibers, kind of like a loose sweater. Now, you were like this, and now it's kind of loosening up. And so doing different modalities helps you add a few more building blocks in there. So at least it can be just preventative. You're just doing it as a preventative treatment. You don't have to do like a major corrective treatment, but if you start to do some things, I'd say, late 30s, early 40s, I think is a good time. That's when most women kind of start noticing changes when it comes to aging. And then you can just kind of do things to maintain your skin and maintain the quality and the appearance.
So you can do that without surgery? Really?
Correct. Mm-hmm.
Now, how is that different than Botox or injecting stuff? Or is that surgery?
Botox Botox is just injecting. You're just injecting areas where you're making wrinkles. So like if you lift your forehead, you have wrinkles on your forehead, or if you're frowning, you have these 11s, we call them, or we have the crow's feet. So there's things that I saw my friends when I went to Israel I think it was like my son was born in 2017. I think I went in 2016, right before he was born. And we're the same age, right? We went to high school together, same age. And I was already doing Botox at the time. And I don't even like super keep up with my Botox. I'll do it like once or twice a year. I'm not like, I got to do it every 3 months. And so you can see the forehead's pretty smooth. But then when I saw them, I was like, oh my God, guys, like we're the same age, but you look older because you have all these very deep etched lines. And I'm like, I got to bring a bottle of Botox with me next time. Next time I go.
And did you?
No,
Did
I
you?
haven't gone back. I actually haven't gone back, but I think that I would. bring one back just to, it doesn't help to do it once. I mean, it helps, but it's like you still got to maintain it, you know?
So you're
It's like-
basically like filling, like let's say you were going to fill in here, then I wouldn't have the wrinkles because it'd be puffed out. Is that? Or
No,
you
you
have to go with each wrinkle.
no, you can fill it. You know, you can laser things and help build collagen naturally without filling, or you can just fill a little bit, hydrate under the wrinkle to plump it up and make it look a little smoother. The Botox is more
Okay.
preventive. It's preventing the wrinkles because it relaxes the muscles, so I can't like move as much, so it's not contracting the skin to create those wrinkles.
Right. Okay. I always think of did you ever see the First Wives Club
Mm-mm.
with Goldie? So funny. Goldie Hawn and I think Ivana Trump. I don't remember who the other ones were. And the very first scene, Goldie Hawn is going to her plastic surgeon and saying, you know, I want my lips. And he's like, no, I refuse. You've had too much. We can't do it. Anyway, she gets off a plane in New York and she's like, there she's it is it's very funny. I always think about that. But anyway, but people don't really get that way, right? Do that. I mean,
Some
you
people,
obviously.
yeah, some people get carried away. They do. And it's kind of one of those, like I had a patient who kept wanting to fill her upper lip. And I'm like, so her lip was like, her upper lip was really big and her lower lip was really small. And I'm like, I was very honest with her, maybe because she was also Israeli. And I'm like, what are you doing? What's going on? You know? She's like, no, I like it like this. This is the way I like it. So I'm like, okay, well then she's going to do it either way, whether I do it or somebody else does it. So I might as well just do it for her and then give her my honest opinion. It's funny because like 5 or 6 years later, she came back to me and she's like, I can't believe I did that. She finally like went back to dissolving everything and just having like normal proportional lips. So it's like,
And you could take it back. So you could bring them back to normal.
yeah, you can dissolve the product. Some things just go away and some things you can dissolve. It's nothing is permanent. I guess that's why it's called maintenance.
And but the people who like, I mean, I don't want to mention any names, but like some celebrities, you see them and you're like, whoa, like they look a little like monsters. You know, it's not their face anymore, and they might have been a very beautiful person, but it's not their face. Like, what is that? Is that just bad surgery?
It's probably a combination of things, right? Probably a combination of surgical and non-surgical things that they're doing to their face. So it's hard to say. It's not like a lot of times they're not disclosing what they're doing.
Right. But is that permanent? I mean, you can't go back to your regular face, can you?
Really depends what it is. You know, it depends what it is. But I think also psychologically it's hard to go back. Like you're used to seeing yourself a certain way and then it takes you time to realize like, oh, I gotta go back. Like this is not my face anymore. Because
Yeah.
you know, when you're making these small changes over time, your face is slowly changing. And then you say, oh, this is not me. Like I had one patient who was always trying to correct little things here and there and she moved away. And then she came back years later when she moved back to Florida and she said to me, you know, I guess I think she was in California or something. She's like, oh, I was going to somebody and I was chasing these little tiny things to the point where I didn't look like myself anymore. And I guess her dad said something to her about like, oh, you're looking like a pillow face or something. And she was like, he's right. Like, I got to take all this out. And then she kind of started fresh again. And, you know, she's more conscious and more conservative about what she's doing. So, and I think it's
Oh, so you can take it out. That's
people too. Like, this is too much. Like, if you add more filler, your cheeks are not going to look natural anymore. Or if you add more filler, your lips are not going to look natural anymore. So, I think it's kind of your job too as an aesthetics provider because you have the aesthetic eye. It's still, to me, it's still like art, and you still have to just correct the person to kind of their natural look and replace what was lost, not change their face altogether. Unless that's really what they want, that's a different story. But then most people, and I think that's the new trend, is people want more natural. They don't want the fake face. They don't want I look like I had something done. They want to look natural. And I think that's
Right.
what our job is in aesthetics, is to let people utilize, these treatments, do these treatments, but still look like themselves and feel better about it. Hey, I look good. I look younger. I look healthier. I'm fresh. I have a glow. I don't have a bunch of sun damage. I don't have to put as much makeup on. That's a big thing too. Women who have like acne or acne scars and they're trying to constantly cover up, they're very self-conscious about it. So being able to, liberate them, the liberation card.
Well, how do you do that? How do you get rid of an acne scar?
So there are laser treatments. There are specific fillers that are more permanent that build collagen that you can apply, like lay down underneath the scar, that also help kind of plump it out and smooth out the skin. Um, CO2 laser is like the gold standard for that. So you can do pretty aggressive laser treatments, kind of like a controlled
And
burn, skin contraction and
yeah,
remodeling.
and then it comes off, like it would come off or something?
Yeah,
That
it takes
layer would,
a week or
oh,
two to fully heal, and then you kind of have that fresh skin underneath. Sometimes you have to do more than one treatment, depending on how bad your
mhm.
scars.
Wow. Now, do you think some people, I don't know, I feel like if I was doing it, I would be like, I need more, more, and more, like as if it's gonna save me somehow. Do you think some people get that way? Like, I need more, do you know what I
I
mean?
think
Like
no,
obsessed, sort of?
yeah, I think it's a personality thing, right? It's kind of like a personality.
Yeah. How do you deal with that?
Like you become
How do you
addicted.
deal with that? Like, yes, addicted. That's what I'm feeling it like now. Like, oh my God, I got to do this. And now I got to, like I don't think it would ever end. Right. That's why I think one of the reasons why I never started, because I would be like, okay, now I got to do this. Right. I don't need another thing to be obsessed about. That's what I say. But, what do you say when someone gets that way? Can you snap them out of it
Yeah,
or
I
no?
do. Sometimes I snap them out of it, and I just tell them, "You're fine.
Wow.
You don't need that. It looks good. You're good." Um,
Yeah.
because at the end of the day,
And
it's
then,
still expensive. I mean, it adds up, right? There's a cost to
yes.
these procedures, and they're like a recurring cost. And I think that in general, like I was raised by my grandmother for a good period of my time, which I consider a very crucial time in my life. And kind of that age 10 to 15, where, there's a little bit of a personality kind of, right,
Yeah.
teenage growth. And I mean, she always raised me. It's like it's not about like that you have to focus on the important things in life, right? You can't be like focused on just materialistic and money. And it's more about, taking care of the family and eating right and taking care of yourself. And um, you know, and then when it was time to have kids, she's like, you got to have kids. And then, and then after I have kids, is like, you have to take care of them. You have to be home for them. You have to raise them. You have to make sure they have food every day and not like eating out McDonald's, whatever. So I think that with aesthetics procedures too, it's an expense. And I think we need to kind of balance, right? You have to kind of balance what are you spending your money on, and what's really important, right? There's a limit. There's things
Mhm.
like have to. I mean, look at you. You have a great show, and I'm sure you are perfectly satisfied in your life, regardless of whether you do something or not. And it's helpful. I think this beauty industry is kind of like it probably has a lot to do with beauty and being more youthful. It's really more about kind of helping maintain youthfulness as far as appearance. These beauty treatments, they're also not just for like maintaining youthfulness and maintaining how you look and keeping up with the way you look, because it's still important. Like people feel like it's important, right? I think there's a lot of even jobs and things that are more like, oh, if you look a certain way, then you get the job. If you don't, you don't, right? Or women complain about, their husbands. My husband left me and now he's with a younger woman, or he's, so I think that whole trying to look more, youthful is part of it. But then the other side of aesthetics is really just like helping people take care of things or correct things that they don't have as much control over, like if they had acne scars, or if they're struggling with acne, or if they're struggling with melasma, or if they're struggling with, other things. Even little things like, I think if you have like the little bump on your nose, and maybe if you're 16, you don't need to get a nose job. Maybe like a tiny little bit of filler if you're 18 or 22, or maybe just a tiny little filler makes you feel better, makes you feel more confident. So there's a lot of just things that you can do with it just for correction. That's non-surgical. It's a non-surgical option, and I think it's great from that aspect.
Okay. So if you like, let's say your vision for the next 5 years, in 5 years, what would be your vision for, I don't know if it's just women or people in general? What would you want to see happen?
My vision for people, you mean in this industry or just in general?
Yes. Oh, yeah, you could say both. You could say both. Yeah.
Vision. I mean, I think this industry in general and kind of what's really evolving now is, and with the use of AI, kind of the medical world is we're starting to kind of utilize AI in that respect, but also people are kind of going more towards longevity and peptides and stem cells and things like that. And I feel like that might be the direction that we're going, and having more personalized care, not like, okay, well, if you're coming in for weight loss, everybody gets the same thing, right? You get your GLP and that's it, right? And yeah, maybe it works for everyone, but you know, if you have the technology, which I think we are, pretty much there, you can really, and there's places that do this more customized, but everything you do is going to be more customized to you, exactly your blood, your hormones, just not just treating the skin with the cream, but also, or the laser, but also trying to figure out exactly what's going to work best for you. And yeah, combining treatments that are more individualized.
Okay. And your vision for the whole world?
Well, vision for the whole world. That's a good one. Have you watched that series on I think it's on Netflix, of David Icke?
No.
No. He gets into like a very 13 episode, very good. I thought it was very good series, and he just talks about how like we've not to get too deep, but I think that the bottom line is like that we need to like be, as in live, and our life from our heart, like from this brain here, from this brain, from this intuition, from the place of love, because it's not the same as how we're perceiving the world and behaving in the world today using just the brain, without the heart and everything that it's like we're all living in our own world, how we're perceiving it, we're responding based on our perceptions. And so I think like if we really were able to all get to that level where we have to bring ourselves back, like don't fight over this, don't have legal battles over financial crap, or don't, like kind of don't sweat the small stuff and do everything out of love and give and receive, then we'll just be a better place, right?
Yeah, I agree. That's what I've been hearing lately, that the ego
Yes.
can't survive in a place of love. So all that divisiveness and judgment and comparison and having to be right and war, it would go away.
And when you watch his series, it really makes you think about that whole ego, like separating your, getting away from that and really just anything that has to do with ego, just completely take it out and not that take over who you are. And that is a very hard thing to do and takes a lot of discipline, which is why probably these monks are, out there meditating and, but I don't know if we're ever going to be there. You never know.
No,
Maybe we'll wake up one day and be there. But he also talks a lot about like how we've gotten to the point where it's just like labels and sublabels, but we're all just kind of people.
Yeah.
And we've just all the labels and sublabels of, cultures and races and religions and genders and are just kind of segregating their way to like label you and tell you who you are, but that's not your identity. Like, why are you putting that as your, so he gets kind of into that and in that depth. And it's just like, you are just one unique point in the world. And like, we all are unique points. But I think his series was great. So
Great. I'm going to check it out. Thank you. All right. Now, this is just a question for me. Let's say we were all coming from love and we were happy with how we are. I mean, I'm just looking. I'm not like.
Then my industry wouldn't exist.
Right. Would it? But I mean, it might for the scarring and the, you know what I mean? There'd be some times when, well, I don't know. It's a good question.
Maybe it would only be love of us grooming each other.
Yes. Yeah, it could turn into something else. Community love fest. Kumbayas and stuff. Yeah. That's
Like
a great question. Yeah. All right. So how do people find you if they want to consult or they want to find out what would be good for them? I mean, obviously, I think you can trust Dr. Arviv. She's going to be honest. She knows her stuff and she'll do what you want and what she thinks is right. So how would they find you?
You can contact me directly on my Instagram page at Dr. Tali Arviv. Also Arviv Aesthetics at the Med Spa. We have 360 Surgery Center for surgery. And then we also last year opened the Med Spa Institute for training. So we also train anyone who wants to get into the industry, do some, consulting and things like that. As far as like, if you're looking to open your business or you're looking to get into this aesthetics, surgical, beauty world.
Great. Well, thank you so much. Thank you for your patience, my technical problems, and I appreciate all your wisdom and your honesty and your authenticity.
Thank you.
Thank you for watching this episode. I started getting real with Hilary when I discovered that I was a people-pleasing, pleasant phony and wanted to be more of my real self. We can grow together if you will like the show, subscribe to my channel, and share this episode with your friends and family so that we can have a world that's more real.